This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is Down syndrome? Answer: Down syndrome, also known as trisomy 21, is a chromosomal disorder that results in intellectual disability, flat facies, prominent epicanthal folds, single palmar crease, incurved fifth finger, gap between first two toes, and other physical characteristics. Question: What are some of the common physical characteristics associated with Down syndrome? Answer: Some common physical characteristics associated with Down syndrome include flat facies, prominent epicanthal folds, single palmar crease, incurved fifth finger, gap between first two toes, duodenal atresia, Hirschsprung disease, congenital heart disease, and Brushfield spots. Question: What is the most common cause of Down syndrome? Answer: The most common cause of Down syndrome is meiotic nondisjunction, which occurs in 95% of cases and is most commonly during meiosis. The risk of this increases with advanced maternal age. Question: What are some of the medical conditions associated with Down syndrome? Answer: Some of the medical conditions associated with Down syndrome include early-onset Alzheimer disease, increased risk of acute myeloid leukemia and acute lymphoblastic leukemia, duodenal atresia, Hirschsprung disease, and congenital heart disease. Question: What are the 5 A's of Down syndrome? Answer: The 5 A's of Down syndrome are advanced maternal age, atresia, atrioventricular septal defect, Alzheimer disease, and an ML/LL. Question: What is the relationship between maternal age and the incidence of Down syndrome? Answer: The incidence of Down syndrome increases with advanced maternal age. The risk is 115 in females under 20 and increases to 125 in females over 45. Question: How is Down syndrome diagnosed? Answer: Down syndrome can be diagnosed through a variety of methods including prenatal screening tests such as first trimester ultrasound, which commonly shows increased nuptial translucency and hypoplastic nasal bone, and blood tests such as increased HCG and inhibin. Question: What is the risk of umbilical hernia in individuals with Down syndrome? Answer: Individuals with Down syndrome have an increased risk of umbilical hernia, which is caused by incomplete closure of the umbilical ring. Question: What is the relationship between Down syndrome and Alzheimer disease? Answer: Down syndrome is associated with early-onset Alzheimer disease, as chromosome 21 codes for amyloid precursor protein. Question: How common is Down syndrome? Answer: Down syndrome is the most common viable chromosomal disorder and the most common cause of genetic intellectual disability. Question: What is the percentage of cases of Down syndrome caused by unbalanced Robertsonian translocation? Answer: About 4% of cases of Down syndrome are caused by unbalanced Robertsonian translocation, which typically occurs between chromosomes 14 and 21. Question: What is the percentage of cases of Down syndrome caused by post-fertilization meiotic error? Answer: Only 1% of cases of Down syndrome are caused by post-fertilization meiotic error. Question: What is the relationship between Down syndrome and drinking age? Answer: The drinking age in the United States is 21, which is the same age as the chromosomal disorder Down syndrome. This is not a direct relationship, but just a coincidence. Question: What are markers for Down syndrome? Answer: Markers for Down syndrome include increased nuptial translucency and hypoplastic nasal bone on first trimester ultrasound, increased HCG, increased inhibin, and increased risk of umbilical hernia. Question: What are the most common physical characteristics associated with Down syndrome? Answer: The most common physical characteristics associated with Down syndrome are intellectual disability, flat facies, prominent epicanthal folds, single palmar crease, incurved fifth finger, gap between first two toes, duodenal atresia, Hirschsprung disease, congenital heart disease, and Brushfield spots.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.